Have you ever noticed how we kind of toss around the words morality, ethics, and etiquette like they all mean the same thing? Well, they don't. And understanding the difference, well, that's an absolute game changer for any professional. Let's dive in.
To really get why this stuff matters, let's just jump right into a situation where the stakes could not be higher. Imagine this: a terminally ill patient who is thinking clearly decides they want to stop life-sustaining treatment. You're the doctor. What do you do? Is there even a single right answer here?
The reality is, you won't find the answer in a medical textbook. Nope. To solve this, you need to understand and balance three different but totally connected guides for how we act. You can think of them as three different lenses that help bring a really complex problem into focus.
Okay, let's start with the most personal one, morality. This is your internal compass. You know, the thing inside you that points to your own personal true north of what's right and what's wrong.
So morality, or a thought in Arabic, is all about those principles you hold deep down. They're shaped by your conscience, your faith, your culture, maybe your family. It's basically your own personal rule book.
And here's the crucial thing to get about morality. It is deeply personal and subjective. It comes from your inner world. So what feels morally right for me might not feel right for you, just because our internal compasses are, calibrated a little differently. Here's a perfect example of morality in action. A doctor who, because of their own beliefs, thinks abortion is wrong and refuses to perform one, well, they're operating purely from their moral framework. That decision is coming straight from their conscience. But personal beliefs can't be the only guide, right? Especially not when you're on the clock. And that brings us to our second guide, ethics. Now, this isn't your personal compass. Think of this as the shared map for your entire profession.
Ethics, or akhlaqiyat, is a lot more formal. It's a structured system. It's a set of rules and principles that a whole profession agrees on to make sure everyone in that field acts with fairness and integrity, no matter what their personal beliefs are.
So, unlike morality, which is all about your subjective feelings, ethics tries to be objective. It's not about what you feel is right. It's about what the group has reasoned out and agreed upon as the right way for a professional to act. It's for the collective, not just the individual.
Let's go back to our doctor. The same one who is morally against abortion might be ethically required to refer that patient to another doctor who will perform it. Now, why would they do that? Because the Professional Code of Medical Ethics says they have to respect the patient's autonomy, their right to choose.
And that principle of autonomy is a huge one, but it's not the only one. Medical ethics is built on this foundation of respecting patient choice, always trying to do good for the patient, first and foremost doing no harm, and making sure everyone is treated fairly. This is the map everyone in the field has to follow.
All right, so we've got our personal compass, which is morality, and our professional map, that's ethics. But there's one more guide we need to talk about, and that's etiquette. This is the social polish that just makes all our interactions go a lot smoother. Etiquette, or adab, is really just the set of accepted rules for polite behavior. It's about decorum, it's about respect, and it's about being considerate of other people, whether you're at work or out in the world. So etiquette isn't about some deep moral right and wrong. It's about social customs. It's the how of what we do, how we talk to our colleagues, how we greet a client, how we communicate respectfully. It's basically the oil that keeps the gears of our professional relationships from grinding.
And don't underestimate how important it is. Being rude to someone or just dismissing them, that's probably not immoral or unethical, but you know what? It can absolutely destroy trust and wreck your professional relationships just as fast. So, we have the personal compass, the professional map, and the social polish. Now let's bring them all together and see how they help us figure out that really difficult decision we started with.
This table really just lays it all out perfectly. Morality, that comes from your conscience, your inner world. Ethics, that's built on external professional codes. And etiquette, that's all about social norms. Really getting this distinction, that is the whole key. Okay, back to that hospital room. We've got our patient who wants to stop life support. How does our doctor use these three guides to make a decision that is sound and principled?
Here's how it all works together, in harmony. First, the doctor acknowledges their morality, their personal belief that preserving life is the most important thing. But second, they act based on their ethics, which says they must honor the patient's autonomy. And third, they use etiquette, communicating this incredibly tough decision with compassion, with clarity, and with respect for everyone involved. That is what being a true professional looks like.
And look, this whole framework, it is not just for doctors in these huge life or death situations. Not at all. This applies to every single one of us in our careers.
So if you only take one thing away today, let it be this simple breakdown. Morality is your personal code. Ethics is your professional code. And etiquette is your social code.
Mastering the balance between these three, that's not just some nice skill to have, it's the absolute foundation of professional integrity. I don't care if you're a lawyer, an engineer, a business leader, a teacher, learning to navigate these three guides is what builds a career that people can trust and respect.
And that brings us to one final question, and this one is for you. Think about it. Has there ever been a time when your personal beliefs, your morality, clashed with what your job required of you? How did you handle that? Just thinking through that question is the first real step to mastering these guides for yourself.